cause of death for both men and women. And the risk is even higher when women are in their menopausal years. Yet heart attacks remain surrounded by myths and misunderstandings. And those misunderstandings can cause people to delay seeking the life-saving care they need. Hi, my name is Sheila. I'm a registered nurse and health coach, and welcome back to my channel, Menopause Energized. You know, I had practiced bedside nursing for over 20 some years, and cardiac nursing was my specialty. I saw so many patients arrive with full-blown heart attack situations that might have been prevented if they recognized, I would say yes, their symptoms earlier and sought care earlier. Chest pain can stem from countless causes: stress, muscle strain, indigestion, and the uncertainty is exactly why so many people try to self-diagnose themselves and end up misreading the warning signs. So today we're kicking things off with a heart attack myth versus fact quiz to help you sort out what's real and what's just guesswork. Some of these answers might change the way you think about chest pain and when it's worth paying attention. It all starts with better education about what a heart attack really is. Today we're going to dive into a little quiz to see whether you are with knowing the truth about heart attacks, because these facts could save your life or your loved one's life. So let's get right to it. Just a little music in between, and then you'll find the first true and false question to come up. Okay, let's start with the first one. It's going to be 7 quiz questions. It's only true and false. I won't have you pick your brain too much. Let's go with the first one, true or false. If chest pain goes away after an antacid, it means that it wasn't really related to your heart. You guys, if you have a pen or paper, you can write it down. That's fine. If you want to pause the video to get a piece of paper and pen, feel free to do that. But again, if chest pain goes away after taking an antacid, it means it wasn't related to your heart. True or false? The answer to that will be false. Chest pain can come and go. So in other words, when you feel like you're having chest pain, it may be due to something you ate, an indigestion, and you take my Lantin or Malox or whatever you take, and that pain goes away. Yes, a lot of times it is due to just indigestion. But what you do have to keep in mind in the future, keep an eye out on your symptoms, because the chest pain could have kind of went away just at the time that you took the Lantin, because chest pain can come and go. So if that chest pain continues after you take your Lantin, then yes, you need to seek attention. Even if it goes for a few days and you're still having it and you're taking Lantin, it's not working, or it seems to work and then it comes back, you need to, definitely seek medical attention. It is so hard to understand what is real chest pain that could be heart related or just indigestion, but you never want to take a chance. But the main thing I wanted you to get was that just because you take Lantin and it goes away, yes, most of the times it is indigestion. But if that pain keeps coming back and leaving and coming back and leaving, you should seek medical attention. Let's go to number 2. True or false? In women, shortness of breath is a sign of a respiratory problem, not a heart problem. And I'll let you look at that, and you decide if it's true or false. And the answer to that is false. Sometimes shortness of breath in women can be one of the first signs of a heart attack. A lot of times the symptoms in women for heart problems get misdiagnosed because our symptoms sometimes may be a little different in us than it is in men. Now, men can have shortness of breath too, but women sometimes it could be just a shortness of breath alone. Again, should you run to the doctor every time you have shortness of breath? If it's consistent or persistent, either one, you should call your doctor and tell them the concerns. I'm not necessarily saying as soon as you get short of breath, you got to run to the doctor, but you know when you're not feeling well. Sometimes it's not just about that symptom. Something you should be able to feel in your body that is not quite right. So again, it has something to do with our microvessels in our heart are a little smaller than it is in men. And so sometimes when we do get the heart symptoms, they'll come a little milder. So sometimes those symptoms may be overlooked or misdiagnosed. And then we go to number 3. True or false? After a heart attack, the heart muscle tissue can regenerate. Again, after a heart attack, the heart muscle can regenerate. And the answer is false. Most of the time, the majority of the time when you've had a heart attack, that muscle tissue is replaced with scar tissue, which means if you had a heart attack, you're going to have to do some modifications on your lifestyle because that tissue there is no longer there to protect you. It's going to form scar tissue, and that's when moderation in your lifestyle needs to take place. We're going to go to the next question. True or false? Men tend to develop heart disease earlier than women. True or false? Again, men tend to develop heart disease earlier than women. And the answer to that is true. And I'll tell you the reason why. Men produce just a small amount of estrogen. We produce, of course, we know quite a bit. And so what happens is men do not have the estrogen there to protect their heart like we do. So they're going to develop it earlier. Now, where we get the risk, the high risk, is that when we go into our menopausal years, because that's when, as we recall in some of the previous videos, our estrogen level declines. When that estrogen level declines, that estrogen actually helps to protect our heart. And I'll talk more about that in some other videos I have on YouTube. You can go back and look at that, how estrogen affects the heart. So our risk goes up higher, just as high as men, when we get in our menopausal years. Next question. The outcome of a heart attack for a woman can have worse outcomes than that of a man. True or false? And the answer is true. Again, women's symptoms are often misdiagnosed. So if our symptoms are misdiagnosed, we may not get the treatment right away because it's diagnosed as something else. It may be diagnosed as who knows, maybe stress. Sometimes, doctors feel like that we are under a lot of stress. So our outcomes can be worse because the symptoms are not always picked up right away. Next question. I believe this is number 6. True or false? High blood pressure is the main cause of a heart attack. True or false? That answer is false. High blood pressure is a risk factor for leading to a heart attack, but it is not the major cause of a heart attack. High blood pressure, along with other risk factors in the body, can contribute eventually to a heart attack. So it's not directly related to a heart attack, but it is a risk factor. And one of the reasons why is that when your body starts building up plaque in the arteries, it narrows the arteries. And also high blood pressure narrows the arteries too because of the constriction when you have blood pressure. And so those two together can make it more risk for developing a heart attack. Remember, most heart attacks happens within the heart muscle itself in the coronary arteries because of the buildup of plaque. And I have a whole 30-day Healthy Heart Marathon that talks about all of that if you want to go back and look at that. And then for the last one, number 7, true or false? Chest pain may be a symptom of a heart attack, And it usually feels like, the chest pain, I should say, usually feels like crushing pain, or you ever hear people tell you it feels like an elephant sitting on your chest? That is one of the major factors or symptoms of a heart attack. Is people will feel, they know that they may be having a heart attack because they feel a crushing pain or elephant sitting on their chest. So I should say, how would I word that? That's usually the main symptom. True or false? And the answer to that is false. No matter whether you are male or female, chest pain do not always have to be the first symptom of a heart attack. I kind of gave the answer away maybe before. Remember I said women don't always have to have the chest pain. They could start off with the shortness of breath and then maybe added to that nausea and vomiting. Men is the same way. Men will usually have some chest pain, but they also can have shortness of breath. But you'll see a lot of times what research shows and what I've seen in my many years at the bedside, that sometimes women will come in complaining of shortness of breath. What else would they have with it? Sometimes they'll have another symptom accompanied with it, nausea and vomiting. And when you hook them up to the EKG and we draw what we call troponins, which is a blood work that shows you if your heart is having some ischemia, sometimes they are having a heart attack. Okay, so when you look at your questions and look at how many you did get right on this exam that we had, and I have a little cue card here that tells you how well you did. So this is not saying that make anyone feel bad, anything like that. It's just making you aware so that maybe some of these symptoms, like I said, for you or your loved ones, you can distinguish a little more between whether you're having a heart attack or not. But this is the thing, it's still not 100%. If you have any of these symptoms, you should seek medical attention right away. Now, I won't go into it in this video, but I will have a video that come up right at the end where I go into in full detail and go into when you should seek medical attention. I give you the 7 or 8 signs and symptoms of a heart attack where you need to seek attention, and that video will pop up at the end. But anyway, if you got a 7 out of 7, 100%, excellent. You will have the knowledge you need to recognize signs and symptoms of a heart attack. 6 out of 7, pretty good, not bad. You just need to educate yourself a little more on the signs and symptoms of a heart attack or what you need to look out for. Again, nothing is 100% foul-proof. If you have some of these symptoms, and like I said, I go to it in full details in the next video, you should never try to diagnose yourself. Seek attention, seek medical attention. And then if you got 5 out of 7, it's fair. Then we won't go down the rest. It just says, it tells you the percentage. 4 needs improvement, and then 3, 2, and 0. We don't need to go into all that because we're not trying to grade you on a test or anything like that. But this was just a little test just to kind of show where you are thinking and knowing some things about a heart attack. Like I said, full video will be coming up next. I've seen countless patients, again, come in with heart attack symptoms that they did not recognize simply because they weren't sure what to make of what they were feeling. But here's the thing that people who, I should say, have the best outcomes. And they weren't the ones trying to diagnose themselves, like I said in the beginning. They were the ones who realized something was wrong and they did not ignore it. The awareness of the willingness to take symptoms seriously, you guys, makes all the difference in the world, and again, could save your life. Also, education matters. The more you understand the truth about heart attacks and just cardiovascular disease, the better prepared you are to act when it counts for yourself or someone you love. So hopefully you guys got a little bit of more information out of the quiz. Now I do, like I said, have a video that should pop up soon where I go to more full details about actually cardiovascular disease, how it's the #1 killer in men and women. And I talk a little bit about that. And then I also, at the end of that video, fully go into signs and symptoms of a heart attack and what you should look out for. So take a look at that video. If you're interested to even dig even further about cardiac disease, like I said, this is my passion. A few months ago, I did a 30-day healthy heart marathon on YouTube, 30 days straight, you guys. And so if you want to take a look at that video, you can skip all around if you want to look at the videos, because I think it's, yes, a total of 30. But it really goes into heart health. You will not be disappointed. And you have time to look at it. It's all been recorded. Also, please like, subscribe, share, comment. I do answer comments because I'm always bringing in weekly insights, I should say, and takeaway. I really thank you for joining. And the only other thing I want to tell you is that I have some exciting things coming up in the future. We're going to be having an 8-week group coaching program live on Zoom. So again, subscribe so you will be notified of that. And we also have a free webinar coming up as well soon. So make sure, like I said, subscribe and you'll be one of the first to be notified. And until the next video, take care.